Hello, I'm Donna Walsh, Health Officer for the Florida Department of Health in Seminole County and your Healthy Seminole host. The term older adults often refers to anyone over the age of 65. In response to the challenges and opportunities of our aging society, in recent decades there has been a growing emphasis on making existing systems and structures more age-friendly. This approach assesses individual needs and preferences and their surrounding environment. Creating more age-friendly communities will encourage active aging by optimizing opportunities for health, participation, and security in order to enhance quality of life as people age. Today, we will hear about initiatives and resources in our community for the aging population. Joining us is Anna Scuteri, Community and Population Health Division Director for the Florida Department of Health in Seminole County. Welcome, Anna.
Thank you for having me, Donna.
Well, on today's show, we're speaking of age-friendly communities, and I know that the state of Florida was recently designated as an age-friendly state, one of the few in the nation. So can you tell us more about the aging initiative throughout the country, as well as what we're doing here locally in Seminole County?
Sure. As you know, aging is a core public health issue, and we joined forces in partnership with Trust for America's Health, and during 2018, we were one of the 30 counties or so that participated in this initiative to create a framework that addresses the health and promotes well-being for older adults.
Excellent. So Anna, how is the health department specifically involved in the age-friendly initiative?
So as part of this initiative, we found out that we have an AARP age-friendly city in Seminole County, and we joined forces with the city of Longwood, met with the planner, were participants of a couple of community focus groups and listened to what all the adults' needs were and worked with the city of Longwood on their action plan. And this brought up the opportunity to meet with other agencies that also serve our older adults, and it became part of our action plan. So after a year long of meetings and webinars, we actually created an action plan and have started with our own agency, adapting our programs to better serve our older adults. So that's where we are right now.
So tell me about some of those programs, Anna, that the health department, and services that the health department provides for the age-friendly
So
initiative.
we provide our regular services, but in addition to that, we have a few of community services, such as congregational wellness, working with our churches and their parish and to better serve those clients. We also do community outreach events throughout the community, and last month we hosted a health event with the city of Longwood, and it came out actually really nice. A lot of participation. Excellent. And we provided resources and information on different services throughout the community.
Perfect. What are some of those health issues that we're finding for our population as they're aging?
Yes, so some of the issues are in accordance with what goes on in the state: falls, mental health, isolation, medical issues that our community faces, chronic diseases, cancer, and Alzheimer's is actually a big one for us here. So we're trying to work on those.
Excellent. So Anna, you know, in working with the city of Longwood and other cities throughout the county, what have we seen as in our focus groups? I know we've been involved in focus groups. Yes. With seniors in the aging population. What are some of the challenges that they're facing in receiving services?
Some of the challenges that they expressed were food insecurities, access to care. Transportation is a big one, so we're working with our transportation system to see how we can help them improve this issue.
Excellent. And then I know that we have many community partners, as you mentioned, that we're working with. Yes. Can you tell us more about who those partners are? I know we are involved in the committee with the county. Yes. On aging, and so can you talk more about those partnerships?
So as a result of this initiative, we have partnered with our Seminole County Committee on Aging, so we're participants of their monthly meetings. In addition, with the City of Longwood, Meals on Wheels, Senior Resource Alliance, among others that serve our seniors.
Sure. I know that we've discovered a number of services that we were unaware of as we've journeyed with this initiative, and we're very happy to be part of the initiative to help provide services for our seniors in the community. I know our vision eventually is to have all 7 cities within the county and the county itself be recognized as age-friendly.
Absolutely.
And so how would we accomplish that? Hannah, what are the next steps?
So I think the next steps will be to educate our elected officials, meet with every city, because we already have services that they offer. We have senior centers throughout the county, so it's just a matter of having meetings and helping them with the application process, and maybe we can do it as a county.
Excellent. So Anna, what message would you like to leave with us regarding the age-friendly initiative?
Well, it's a fact that we're all going to age, and as a matter of fact, Seminole County has a population of 21% of people over 60, so we are going up, and we can collaborate and work on this initiative and help our citizens with services and whatever is needed for them.
It sounds all wonderful. Thank you so much for joining us today.
Thank you.
Here are 6 tips to help improve your health and prevent chronic disease as you age. Eat healthy. Make healthy choices like fruits, vegetables, whole grains, lean meats, and low-fat dairy products. Get regular physical activity. Being active can help you prevent, delay, and manage chronic diseases. It can help improve your balance and stamina and reduce the risk of falls. Regular physical activity can also improve brain health. Quit smoking. Take the first step and call 1-800-QUIT-NOW for free support. Get regular checkups. Visit your doctor for preventive services, not just when you're sick. This can prevent disease or find it early, when treatment is more effective. Know your family history. Share your family health history with your doctor, who can help you take steps to prevent chronic diseases or catch them early. Be aware of changes in brain health. Everyone's brain changes as they age, but dementia is not a normal part of aging. See your doctor if you have questions about memory or brain health.
Myrna Chamorro is joining Lori Robb at Meals on Wheels to find out more about the organization.
Joining me now is Lori Robb. She is the Director of Community Relations for Meals on Wheels. Hi, Lori.
Hi, how are you?
I'm good, thank you. Thank you for taking the opportunity. I see all the time Meals on Wheels vehicles on the road. Tell us about the program. What is it?
Wow. Meals on Wheels, etc. is more than just a meal. Basically, we offer services to homebound seniors. It started in 1973, where we were providing transportation services and meals to homebound seniors that could not get out or leave their homes. But it's developed into so much more. As you see the vehicles on the road, we have fallen into an etc., which is all of the additional services that we offer beyond the Homebound Meals program.
Wow, excellent. We just followed you to a person where you were delivering one of the meals. Tell us about that experience that you had there.
Volunteering, our volunteers are really the lifeblood of what we do, and getting the chance to go out and deliver those meals, those seniors, sometimes you're the only person that they see in a day. When we get the chance to go deliver them nutritious meal program, we go in, it's not just drop off and leave. Often it's, they welcome you in, as you saw. We get to sit down, we get to talk about their day, see how they're doing. It's kind of a wellness check, if you will, too. A lot of times the seniors are forgotten. So we kind of go out as volunteers when we're doing those services, and we get to sit down and chat with them and find out a little bit more about maybe some additional needs that they have beyond just delivering them the meals and the company that we provide.
So besides going to the home, like you said, etc., we are here at a congregate meal or a dining center.
Yeah.
Tell us about that.
We have 4 dining sites throughout Seminole County. This is one of our larger dining sites here in Castleberry, but our seniors are so loved, and they're provided transportation here. A lot of these seniors, though, can provide their own transportation because they're not homebound. So this is the alternative to the homebound delivery program, where they can come in, they can be amongst their peers, they're not just sitting at home. They're provide nutritious meals here by our wonderful site supervisors and all the volunteers that come and help out here as well, and serving the meals, and then just visiting, and they get to play bridge, and they get to play bingo, and they get to play, and just talk. And probably this is one of the greatest things, is because seniors, as they age and they become more lonely, they need to be amongst their friends, and like-minded people. So they all will tell you, as we've been talking today and I've been walking around, they love the Meals on Wheels program because this offers them a Monday through Friday service where they can come and they can enjoy time together.
And they love the meal, but of course they love the time that they have to interact with your staff and volunteering. So how many people do you serve here in Seminole County approximately?
Seminole County, for congregate dining, we probably provide meals to about 172 seniors per day on average. And that's a tremendous amount of people. We always are open for more. We want people to know about this opportunity to get congregate dining and get on our program because we have no wait list. So we have the availability there for them to come and dine with us. So we need to get the word out, and that's my job, is to educate and advocate for that. As far as the home delivered meals program, we probably deliver about 375 meals per day. So out of our building, that 175 plus 375 go and leave our building every single day. Those meals are cooked in our kitchen. Our cook comes in every day with our crew. They prepare the meals early on. We have volunteers that come in and help package the meals, and out the door they go to our wonderful volunteers that go deliver, or our drivers that deliver them to the congregate sites. So it's a big mission, and it takes an army to do it.
You have a passion for it, and there's so many people that enjoy the program. How can people apply and learn more?
Yes, basically they would call our home office, which is the number's 407-333-8877. They call the front desk. There's an intake coordinator there that would take the application. Anybody 60 and over can qualify. Beyond that, we basically assess the need. They get run through a database to see if they're receiving any additional services. And then through that, we send out a caregiver that goes out and assesses the home and the situation. Clearly, the ones that are in most need are the ones that are living alone, are debilitated, that have no family nearby. A lot of them, they're in their ending days, they're in hospice, or we've been called by a caregiver, so they jump to the top of our list. So we do have a wait list that's probably about 350 people long right now. We need volunteers. We need funding desperately. Only about 38% of our funding comes from the federal government. So we're always looking for businesses that have the deeper pockets with big hearts that want to contribute, volunteers that want to give their time, whatever time that may be, to come out and provide congregate dining, volunteering, or really we need drivers for our home delivered meals.
Excellent. So there's something for everyone, those that participate, those that want to volunteer. So thank you so much, Lori, for taking the time and for running this wonderful program.
Thank you so much.
I'm here with Sergeant Adam Bryant with the Longwood Police Department to tell us more about the Age-Friendly Community Initiative. Welcome, Adam.
Well, thank you.
Thank you so much for joining us today.
You're very welcome.
So I understand that Longwood is a designated age-friendly community through AARP.
That's true.
And we'd love to learn more about what you all are doing.
Absolutely. We started up this initiative to just be more inclusive. We realized what our city was. We saw a voice that wasn't being heard. So we drew up an action plan so we can address that very issue.
That's amazing. I know we learned of Marie Reagan, the city planner for Longwood, and kind of saw her at a mutual meeting, community meeting, and got very excited about what you all are doing. What are some of the steps you've taken in this journey so far?
Okay, well, Marie is the one that spearheads this whole thing, so this has been her baby. Now, the steps that we initially took to get this whole thing started, as I said before, we realized a lacking in the community, and the commission saw it as well. So we carved up an action plan, and we started developing programs. We started developing services that we realized we didn't have before that would be advantageous for our aging community. With that, we teamed up with AARP as well as World Health Global for Age-Friendly Communities in 2016, and after that we were off to the races.
Oh my goodness, it sounds very exciting. Can you tell us a little bit more about some of the specific programs and services that you...
Absolutely. Let me start with some of the programs that we have throughout the city, some resources that we started, because that's something I'm really excited and passionate about. We offer anything from fitness to yoga. The other day we had our first age-friendly health fair that also had dance lessons at it. These dance lessons even included lessons for those that might have some mobility issues. One of the programs, which is my personal favorite because I'm in charge of it and it's near and dear to me, is the Are You OK program. It's offered through the police department. And what it is, let's say we have somebody that can't quite get out to these events that we're doing.
Sure.
What we do is, with their family's permission or their permission, we attach them to a list, and we'll have officers or COPs stop by their residence. Now, this can include anything from just a simple visit of how are you doing or are you okay, to where we've had them go inside and help them with issues. I've gone in and hung a clock inside a house before where they were just waiting for us to come by and somebody to help them out.
Sure.
To anything with helping them with some paperwork that they might not understand, and go in and just visit with them, just generally get to know them.
That program sounds excellent, Adam. Are you working with any other cities within the county regarding age-friendly communities?
Well, right now, since ours is still kind of in its infancy, we're still getting ours to as full and robust as it can be. Sure. Now, we've had some cities inquire on what it is that we're doing, and kind of shared with them the initial steps that we took to get started. As I said, we partnered with AARP, but it's not as simple as just filling out an application. Sure, sure. You actually have to show them that you have a positive drive and are determined to actually meet the goals and requirements that they set forward to truly change your community.
Adam, what message would you like to share regarding our aging population and what we should do as we continue on this journey? Okay.
Well, the trip's not easy. You can't just declare we want to be an age-friendly community and then all of a sudden you are. Because unfortunately you don't want communities that are age-friendly on paper.
Sure.
So it is a long, arduous journey to get that way, but I think it really takes people driven like Marie, who actually see the direction they need to take them and are not just compelled, but actually have poured themselves into this. And I think when you have people like that as a collective working together with a positive city, a commission, different departments inside the city that want for the same goal, we're able to create this type of environment that addresses this specific group of our city. And although, as I said, it's been a long drive, it has by far been one of the most awarding endeavors that I've been involved in, and I'm sure Marie would say the same.
It's amazing, Adam. Thank you so much for joining us today and for all that you're doing to help our aging population.
Oh, you are very welcome.
Thank you. The Westside Community Center has a very active seniors group. Myrna Chamorro is on location to tell us more.
Joining me is Britt Henderson from the Westside Community Center. Hi, Britt. Welcome to the show.
Hey, how are you?
Good. You have a very active senior group here at the Westside Community Center. Tell us about that.
Yes. So the Westside Senior Program has been in existence going on 10 years now, and we provide services for our senior community Monday through Friday from 9 a.m. to 1 p.m. On Mondays and Wednesdays, we have a quilting, sewing, and knitting program. On Tuesday, Thursdays, we have an arts and craft program. Fridays is Bingo Friday. And we have about anywhere from up to 50, almost 55 seniors that participate in our program. In our fitness room now, we have seniors that come in the morning and work out on the exercise equipment. Some do rehab, that's had reconstructive knee surgery or any type of surgery that requires them to do rehab on it. A lot of them come in here and do the rehab.
So you have a variety of programs, arts and crafts, fun, game time, but what related to health? Tell us a little bit more about those activities. I know we have exercise right here.
Yeah, so we have a health class provided. It's called a chronic disease class, which is an 8-week session that meets on Wednesdays from 10 o'clock to 11:30. And it provides them diabetes help. It provides them information about any chronic disease that they may be experiencing. Also, we have a fitness program on Monday evening called cardio drumming, which is from 6:30 to 7:30 here at the Westside Community Center. And then on Thursdays, we have a fitness program through Care Plus. Mr. James teaches that class, and that is from 11 o'clock to 12 o'clock. And we also have, various other doctors and health providers that come in and talk to the seniors about health issues.
Excellent. So it's well-rounded program. They have fun. Do they enjoy being here? How is their activities? You know. And
well, the seniors they really enjoy the program. The city of Sanford sponsors this program. We've been sponsoring it for 10 years, and I tell you, it's just nothing like having a group of seniors here where they come and fellowship and bond with one another. We've actually even had one couple that married each other in this exact room. Just they were just working out one day and they just started courting and they got married. I like to pride myself and say, we greet everyone with a nice smile and our arms are open for anyone that comes into our facilities.
We speak about seniors in the aging community, but who can join? Who is a senior?
Well, we really don't have an age on it, who is a senior, but we start at, we would say 50 years old, but our youngest senior is 50 and our oldest senior is 84. So we open our doors for any age. Excellent.
So anything you'd like our audience, our community to know about the program at Westside Community Center?
Our program here is a free program, and as we mentioned earlier, we provide an array of services for our seniors, but also for our community as well. So our doors are always open.
Thank you so much for the time that you've provided to us.
Thank you.
Recently, I had the opportunity to speak with Penny Cedar, chair of the Seminole County Committee on Aging. Here's what she had to say.
The Committee on Aging was formed in 2007. The Board of County Commissioners wanted a group of people to give them recommendations about what the needs are for the seniors in Seminole County, policy recommendations, and just come to them with what are the challenges that face the aging population in the county that they represent.
Penny, who all is involved on the committee, and can you tell us a little bit about the accomplishments so far?
So there are spots for folks that represent senior facility housing, which is where I come in with Habitat for Humanity. I'm the housing representative. There's a requirement from somebody at the state attorney's office to be on the committee. Faith-based organization. There are some spots for local seniors, so that we have the representation of the folks that we're making the recommendations for. Healthcare industry.
And can you tell us a little bit about the accomplishments of the committee so far?
Well, we decided that we really wanted to be the eyes and ears of the Board of County Commissioners, so we decided to first bring in guests to come and speak to us about some of the issues that face the aging population. So we went to Meals on Wheels, and we had somebody from AARP come and talk to us. We had, at the time, Mayor Joe Durso from the city of Longwood to talk about the issues that they see and share with us their expertise in terms of the aging population. So we did that first, and then we decided that we would, as a group, go out to 4 different locations in the county and have community discussions and invite folks from that area to share with us firsthand what they thought the issues were, and that way we were really hearing from firsthand from the people that are residents of Seminole County and representatives of different areas what their biggest challenges were.
That's excellent, Penny. So speaking of challenges, what are some of those challenges that our older adults identified?
So in all 4 of those community conversations that we conducted, we saw 3 main issues that were reported. Number 1 was transportation. Number 2 was elder care. And number 3 was housing repair. So those were the top 3 that the residents of Seminole County shared with us that were the biggest challenges for them.
It's great, Penny, that those areas are being identified and that we can address those. Can you tell me about the resources that are available in Seminole County for our older adults? I know as we went along with these community focus groups, we were able to discover that there are some resources already out there. So can you talk a little bit about those available resources?
Well, one of the biggest resources I think is Meals on Wheels, and they do a lot with what sounds obvious, which is bringing nourishment and meals to the seniors. But they also do things like weatherization and have some other wraparound services for the elderly. Definitely, there are churches and there are senior facilities located throughout the county. And a really great place to go find that information, I think, is to go to the Seminole County website under Community Services, and there is a tab for elder care resources. But you know, the AARP is a good resource for seniors. Legal Aid, the Senior Resource Alliance, and like I mentioned, Meals on Wheels. Those are all really great resources for seniors in our community.
Excellent. Thank you for sharing that, Penny. Penny, what message would you like to leave our audience about the committee, as well as resources to keep our older population healthy in Seminole County?
We're very interested in having resources available on that website. So if there are resources that people know of that I haven't mentioned that fall into that nonprofit realm, we'd like to hear from folks so that we can post them on the website. The meetings that we have are open to the public, and I encourage people to come and share, again, resources or concerns that they have. We're there to listen and then to be able to report that back to the Board of County Commissioners. I think as the member on the committee that represents housing, I would like for our county leaders to really consider the communities of a lifetime, because that really will create our entire county as a place for seniors to live that's friendly for getting around to things like healthcare needs. Transportation will be easier. The whole community will embrace the seniors that live there and make it a place where it's easier for seniors and where seniors are embraced.
That's great, Penny. Thank you so much for joining us today and for sharing this information. We look forward to continuing to work with you.
Yeah, it's great. Thank you for having me.
Absolutely. Currently, Florida ranks first in the United States in the percent of the population who is full-time and seasonal residents over the age of 65. This growing aging community comes with some challenges. It's not only about the older adults, it is also about their families and the community they live in. In Seminole County, there are a variety of resources. Visit a local senior center, attend a local health fair, join a diabetes self-management program, or enjoy a meal at a congregate dining site. There are many opportunities for you right here in Seminole County. Thank you for joining us today, and thank you to our distinguished guest. I'm Donna Walsh for Healthy Seminole. See you next time.